you very much, sir. Good morning, everyone. I thought of giving you a brief introduction about my specialty, especially because we have a limited exposure for dermatology during our medical student career, maximum 2 weeks. So it's a branch of internal medicine. Actually, it was a subspecialty in internal medicine years ago. Now we have a separate stream, separate college of study, board of study, and college of dermatology. But still we remains a close associate of internal medicine. So if you know your medicine well, it is easy to get through the selection exam. We are a bit of a calm and quiet specialty, but there are few emergencies, and when they occur, they can be pretty dramatic. It is a visual specialty. So everything is on the skin. Anybody can see the lesion, the patient, family, and the society. So you are supposed to make a correct diagnosis quickly and deliver your results fast. Demand is high because how small is the lesion, the quality of life can be severely affected, and the patient's expectations are always high. Our work is mostly outpatient basis. There are involved facilities in teaching hospitals and big hospitals, but in peripheries, mainly base hospitals, we have to get help of our surgical and medical colleagues to share both facilities. And the management of dermatology has gone far beyond betamethasone and miconazole, right? We are one of the specialties that deal with immunosuppressives quite a lot. They have changed the quality of life of the patient significantly. So it's quite exciting, and we all have now biologics and everything available in the government sector, and they also come with number of side effects, so it can be challenging at times as well. And if you like little bit of surgery, you can do that as well because we do minor excisions on the head and neck area. As well as there are some other treatment modalities as well, such as laser, phototherapy, cryotherapy, and all, which are available in both government and private sector. And when it comes to the selection, actually, you select what you like the most. And most of you must be having one or two options in your head, but please consider some other facts as well, especially the chances of getting through the selection exam and the specialty that you are going to do, whether it suits your lifestyle, because one might like a specialty with 24/7 on call, while the others might like a specialty with weekends often where you can stay with your family. You have to also consider earning capacity as well as the opportunities in working abroad. There are certain specialties where the opportunities in working abroad is really high, especially in countries like Australia. I just want to highlight this fact again because when it comes to dermatology, this is how the candidates being selected at the part one selection exam over the years. If you can see that it's almost always around number 5. It is not because that the exam is very strict or the candidates are doing poorly, it's mainly because of the card provision available within the Ministry of Health at the moment. So it's wise to have a backup plan as well. If you want to do dermatology, study for medicine selection exam as well. They don't clash with each other. And studying medicine also helps because 50% of the MCQs in selection exam in dermatology are from general medicine. So if you miss out in dermatology, you have another option as well. Just a suggestion. And you can, I mean, website, you can download prospectus. I'm just going to rush through. And this is a structure of the part 1 exam. As I said earlier, there are 30 MCQs, 50% from general medicine. And even within the projected material, the slides, there are 5 out of 20 from general medicine, right? And these are the training centers we have at the moment. And the registrar period 2.5 years. And within that 2.5 years, there's 1 year you have to work as a medical registrar in a general medical ward, doing casualties and RP on course. And at the end of that 1 year, you have an exam purely based on general medicine. So you can see how important general medicine is to dermatology. And after your MD exam, so you have 1 year local training as a senior registrar and the overseas training up to 2 years. Where earlier it was only attachments that we were offered in countries like UK, but now you can secure a paid job during your overseas training in most countries. So these are the requirements for board certification. MD Dermatology, post-MD overseas training, your portfolio, and the research proposal. And once you get both certified, there are three paths ahead of you. Either you remain in the state sector or resign and join private sector or migrate. And as you can see, we are in the state sector. Only few have migrated so far. Mainly because there are many advantages, the job security, and you can see a lot of patients with you can improve your clinical skills, you can perform minor surgeries and improve your knowledge as well. However, there are some disadvantages as well because now the card, the most demanding places are being filled and you will be posted to peripheries. And so you sometimes you might be the first dermatologist in certain base hospitals. So you have to start from the scratch, set up your own clinic, and build up your staff. But that's not a big job. I mean, you don't really need sophisticated instruments to build up a dermatology clinic in a periphery. It's mainly outpatient basis. And the other disadvantage is we don't have subspecialties in our country yet, but in other countries there are pediatric dermatologists, dermatopathologists, and so on. But that might become a reality very soon. And dermatology always goes with cosmetics, cosmetic dermatology. If you are remaining in a big center, yes, you can do practice that, but in a periphery, you may not be able to. But eventually, you might come to a bigger center with annual transfers and all. And this is the whole reason why there are only 5 people being selected in the part one exam. The card is being gradually filled. But the Ministry of Health, the PGIM, Board of Study, and the college are working hard to identify new vacancies within the government sector for the upcoming trainees. And if you decided to join the private sector, you can earn some money and practice cosmetic dermatology because all these big private hospitals now have their own cosmetic dermatology centers with state-of-the-art facility equipments, and you can remain closer to your family as well. But the number of patients that you see with variety may be less when comparing to government sector, and there's always a competition from your colleagues, other specialties, and from people such as beauticians and cosmetologists. And if you decide to migrate, and now the situation is much favorable. Earlier, it was really difficult for us to get a job locum consultant post in the UK, especially UK, because we had to go through MRCP pathway. Now our MD dermatology degree is well recognized. You can, through Royal College of Physicians, you can get GMC registration in the UK and get locum consultancy post as well. So I hope you will choose wisely. Thank you and good luck.